end up with catastrophic expenditure. And this is something we can deal with. Donor spending is also uncoordinated. We, Nigerians, should be telling people trying to help us how we want them to help us. Compared to our neighbors, if you look at the statistic, we have an accompanying Lancet paper that looks at this in great detail. And sadly, even when we compare to countries that are poorer than us in terms of life expectancy and the number of kids dying, we actually do poorly. This says to me that there's an opportunity to spend the money we spend better, because we are spending more than they are and we're not doing as well. But there is also an opportunity to do more by spending more. So I'd now like to talk about, because it's not all doom and gloom, the opportunities that exist that we should be building on. So firstly, some progress has been made, in particular around mortality. Over the last decade, 2 decades, mortality has dropped year on year in Nigeria. Fewer people are dying. Life expectancy has increased by about a decade over the same period, and there's a lot less disability. Excellent initiatives such as the Healthcare Provision Fund and the health insurance schemes in the federal government and the state are all good starting points towards what we need and must do, which is increase coverage in the health system. There are also numerous examples of success in communicable diseases. We dealt with Ebola. We tackled COVID-19 adequately. We dealt with Lassa fever and monkeypox repeated outbreaks. We can do this. Nigeria was able to conduct the largest and most complex HIV survey with hundreds of thousands of people on time and on budget, and now we know how many people have HIV in Nigeria. We were able, despite all the skeptics, to get to a point where we are certified of being wild polio free, a significant achievement which we must build on. So I'd now like to move on to our recommendations, which is the final part of my talk, and there's quite a few of them, but I'll crave your indulgence and I'll go through them as rapidly as I can. So the first one relates to, given our young population, prevention really ought to be at the heart of health policy. The case for this is absolutely clear. All of our modeling and analysis suggests for little amounts of money, as little as 400 naira, you can get several-fold the benefits in interventions such as better cooking fuels, better nutrition for our kids, and access to contraception. You can multiply the benefit several-fold. This makes the case that health really ought to be in all policies. We also need to make strong investments in public services to create a healthy population, and this has to be multi-sectoral. We have to get government functioning properly with funding, governance, communication, and accountability. We need to empower that in all settings we have a place-based approach to deal with these wider determinants of health,